Frederic Coppens. I'm working at VIB here in Ghent, so the Flemish Institute for Biotechnology. This is a life science research institute, so I'm coming from the research side of things. And I'm heading the VIB Data Core, which is the core facility for research data infrastructure. And I'm also head of node for ELIXIR Belgium, which is the research infrastructure for data in life sciences. And I'm going to be mainly focusing on that today and how this relates to what we do in for human data and healthcare in this infrastructure. So very briefly, ELIXIR is a research infrastructure at European level, part of the S3 program. So there's about over 60, I think, of these research infrastructures. And this is specifically for data in life sciences. What we try to do is bring together all the institutes that have resources around bioinformatics, around data in life sciences, databases, tools, but also training materials, the standards we use, into one big network, and basically trying to improve the interoperability of all of these components. And this is, of course, really a network of people. We're bringing together all of these people, and we're trying with small projects all over the place to make this interoperability work. And I'm not going to go in detail how it's organized, but we really have a kind of a technical backbone, which we call the platforms, around different topics, where we bring the experts on a technical level together. And then we have a lot of communities where we have the actual people running research, doing the data analysis, to make sure that we don't build some kind of abstract platform that nobody is able to use, but that it's actually fit for purpose. And here at the bottom, you can see there's a number of communities around human data, federated human data, human copy number variation, rare diseases, where we are really focusing on this aspect. In Belgium, we also have a number of services that we are working on around data analysis and data management. I'm not going to go in detail. I just want to use it as a kind of example how we work. One thing that we've done recently in a Horizon Europe project that finished a couple of weeks ago is the Research Data Management Toolkit. The problem we wanted to solve is that to actually know how to handle data in life sciences according to best practices, you kind of need to be in the bubble. You need to know where to go and look for information, because there's a lot of things out there that it makes it really hard to actually find the relevant information. So what we did here is bring together the experts in our community to make a resource, a web resource, that brings together all of this information and kind of signposts to the relevant places where you find all the details. And this contains best practices, the guidelines, all the tools that we are using, and examples of how people have done it in their institute, in their country. And this allows us to kind of scale this and really provide support for individual researchers in a scalable way. We can't go and talk to them, there are just too many. So here we can really go into depth, and we can link to training materials, to tools, to databases that are relevant and that are commonly used in life science research. And this is not an effort of a few people. This is really a community that we've built. We have almost 180 people that contributed to that in the last 3 years, more or less. We have 500 tools that are listed. We have 122 pages that have been written. So this is really a community effort. And this is where the trust that was mentioned already and other things, this is really important. Here we need to build this network of people that know each other, that trust each other, that work together. And we've done this during COVID, so this was done fully online, which was an experience also for us. But in the end, it was good, I think, because we could kind of progress way faster through online meetings than we would have in face-to-face. And this is all done very collaboratively, and this will also allow us to maintain this without a dedicated project towards the future. One project that's now running that kind of is a spin-off of that, or is using some of these concepts, is by COVID. This project came about during COVID, the name stands for Beyond COVID. What we wanted to solve here is that there's a lot of data that we want to use to, for example, answer policy questions. And I think it's been said a lot that it's been extremely hard to get access to these data, to know where the data is. And in COVID, a lot of people did a lot of initiatives to make this easier. But again, it's very hard to find this because Google doesn't help you enough. So here we have brought together a consortium to identify the different data sets that we want to combine, to mobilize them, connect them based on standards, and then expose them. And again, we've made a resource to actually disseminate all of this information, and this is done in collaboration with a lot of other research infrastructures in Europe to, again, make sure that we capture this information and share it across the whole of Europe and globally. One aspect, or until now I've mainly focused on the data management side. Another aspect is we need to be able to analyze this. We had another project, it also just finished, to create this collaborative space. And I'm not going to go in detail, but this is kind of a representation of how we built our data analysis infrastructure. There are a number of different components that you need to be able to have the right tools. You need to string them together into workflows. You need to be able to run them on some compute hardware. And if you do this for life sciences or for other types of research or in healthcare, if you want a kind of flexible system, you're going to end up with something that looks very similar to this. So this is really reusable also in other domains. And the important part for us is at the bottom you have registries. These are catalogs that bring together all of the different resources that we have and that make them easily findable and shareable. And based on all of this knowledge, we've brought together, I'm going to skip this, and we are now also applying this to the genomic data. And this is the main project that I want to discuss today. This is a Digital Europe project where we are building infrastructure for genomic data to store them, to share them across borders in Europe. This comes from the 1 Million Genomes initiative. This is already around for probably a decade. And this is a European initiative to have access to genomic data across Europe to support healthcare in the end. And Belgium signed this in 2018, and we are now building infrastructure. And the aim is, in a way, very simple. You have this loop of research and then integration in healthcare that we need to support and enable. And okay, I was expecting a different slide. One of the aspects that we do here is the, we have on the one hand the genomic data that we want to store, and we can do all kinds of fancy analysis there, but we do need to link to health data for the real innovation. So we really need to collaborate with European Health Data Space, which is still under development. Genomic data will be part of that, and we need to make sure that we can link those two infrastructures. Also, for example, what is mentioned here on the slide is UKIM, which is for cancer imaging. This is similar data to genomics data. It's also very large volumes. It also requires supercomputing in a lot of cases if you want to do research. So we can use or reuse the infrastructure we're building for these kinds of data, and again link them to what we are doing in genomics data. And so what we're trying to do here is building on all of these resources that we already have in ELIXIR and bring that together and now deploy that for genomics data.